Hello everyone. So as of today, I'm 33 and five days pregnant. So I just want to show you what my tummy looked like at 23 weeks and 5 days pregnant. And these few weeks have been so challenging for me. Like, I just thank God for bringing me this far, because it all started. Initially, let me just say, I changed my antenatal, and the main reason is because my father-in-law used to say, when you are close to delivery, just go and register in general hospital. General hospital is the best. General hospital is the best. Initially, we didn't plan registering in general hospital. We were like, we'll tell him we've gone there and we'll not go. In fact, when I wanted to start antenatal in Lagos, the first day we were looking for hospitals. We actually went to that general hospital, but the crowd we saw was so discouraging. We just laughed and walked out of the hospital. So we went to look for that private hospital. So we got to a place and I was going there, going there. I still went there till I was like 29 weeks, and my appointment was every 2 weeks, like 2 Fridays in a month. This the second Friday and the fourth Friday, like every 2 Fridays. So each time I went, I was always complaining to. They have different doctors. The one you meet this Friday might not be the one you meet another Friday. But I was always complaining to the doctors that I was having lower tummy pain, and especially the one that is a female. She always be like, "It's normal. It's your first baby. It's not your first child." I'll be like, "Yes." She'll be like, "It's a normal thing. You're fine. Um, any other complaint?" I'll be like, "No." They are trying. No, they are doing their best, but I don't know if it's truly normal or maybe it's not normal in my case. I don't know. So I kept on living like that, like that, like that. Sometimes I'll feel the pain. Sometimes I'll be fine. In fact, she even gave me the mentality of that is the way pregnancy should be. Like, it's a normal thing for you to feel pain at the lower part of your tummy. So we were living like that, Sha. They used to give us drug in that hospital. Each time you go, they'll give you folic acid, B complex, and ferrous. I was not always taking it because I was using pregnancy care plus. I've always been using pregnancy care plus. So later, the thing became worse that I wouldn't be able to sleep at night. Because at that time, I was entering my 30th week. I called a friend of mine that is also pregnant. I was like, what symptoms have you been seeing? How has it been for you? Do you feel any pain? She was like, no, that if not when her baby is kicking, she's fine. So I started realizing that it's not normal for me to feel that pain. I go online to check. I found something like lightning crouch. So I thought I was having lightning crouch. I was deceiving myself that I was having lightning crouch. And each time I spoke with her, my friend, she would tell me she's fine. And I don't really feel fine. It's not like I'm sick, but I'm always having this pain here. It's been like that, Sha, for long. So eventually, my 30th week, I decided not to go to that hospital again, because the last time I went there, I was 28 weeks. I go there every 2 weeks. So my next appointment was supposed to be my 30th week. So I told my husband that let's even try this general hospital. Let's endure and just overlook the crowd and go there to queue and see how it's going to turn out. So when we went to general hospital, the first time you go there, it won't be your antenatal day. They'll just give you like orientation, what they do, how to go about their stuff, the day you come for your antenatal and all of that. You pay the day you come for payments and stuff like that. So we went through we went the first day, it was on a Thursday, and they told us to come the following week. So we came the following week, we did all the registration, all the people to go, now. I got dates for antenatal. So as at that time, my first appointment in general hospital, I was 31 weeks. So was it 31? 30 going to 31 weeks, sha. So when I got there, the the doctor that attended to me, I told him my complaint, and he was busy writing. As I was saying it, in fact, I felt like I was giving statements. He wrote everything I said down inside my file. Huge, plenty. So, conclusively, he said I was having preterm contraction. I was like, what does it mean? I was trying to explain like preterm contraction, if not prevented or worked on now, I'm going to have premature delivery. I was like, but before now I've been fine. It's not like I'm sick or anything. So he tried to explain to me that I might not feel sick, that but I'm not supposed to be feeling pain at the lower part of my tummy. He said all manner of things, and told me to go for tests. I went for several tests, infection tests, HVS, blood count. So apart from the antenatal tests that you go for, all those blood group, HIV, I went for several other tests, like 6 of them, and they all came out fine. He also told me to go for scan. I went for scan. The scan was okay, but I kept on having the pain. So I told like 2 weeks before then, I noticed that my pregnancy care plus, each time I use it, it pains my chest. Like anytime I use it, I'll be so weak and I'll start having pain on this part of my chest. So I complained to the doctor. He told me to stop it and start using folic acid, B complex, and ferrous. And he didn't even know they used to give me that, my former antenatal. The one they used to give me, I used to collect them and bring them home. I'll just keep them somewhere. So as at that time, I had plenty of it. So I had to drop the pregnancy care plus and bring them out from where they were, start using them. So when the test results came out negative, I was fine, but I was still having the pain. He suggested several drugs for me. I used the drug for like 1 week, and I was supposed to, like, my appointment was supposed to be in the next 2 weeks, but because the doctor wanted to monitor me and see how well I was doing, he told me to come back the following week. That's when I go and fix a date. I should tell them to fix the following week for me, not 2 weeks to come. So when I went back the following week, then I was like 31 weeks plus, going to 32 weeks. When I did my BP, because each time you go there, you do your BP, you check your, I think, protein level, because they take your urine and then you do your protein test, then your weight. So when I did my BP for the first time since I've been doing since I've been checking my BP since the inception of this pregnancy, my BP was extremely high. I wasn't feeling sick. I was feeling normal. My tummy was getting better, even though I was still feeling little pain, especially at night. But my BP was very, very high. I had to do it like when I did it at the general place where you do when you come before your doctor will call you in. The result was high. Immediately I entered his office, he said I should follow him again. He had to take me to one emergency room to do the BP again. It was still the same. So it was like, what was I thinking? I said, I'm not thinking about anything. That could it be the drug that has affected my BP? The drug he prescribed for me for the preterm contraction, because then they prescribe like 2 drugs. One I'm supposed to be using 1 daily. The other one I'll use 2 in the morning, 2 at night. So when I was trying to control the preterm contraction, I was using, apart from the 3 tablets, which is the ferrous, the folic acid, and the B complex, I was also using the 1